Erectile dysfunction, or ED, happens to millions of men for many different reasons. Men just like you. It may feel unfair to you, like you've lost an important part of your life, a part of yourself. It's natural to feel like this, but there are treatment options to help you. The treatments for managing ED are focused on permitting the patient to obtain and maintain an adequate erection for successful intercourse. Each option has varying degrees of success and reliability. The information you learn today may help you decide your next step. What's most important now is that you're seeking a solution. This is a good first step in treating your ED. Well, I'm sure you have many questions, so let's get started on getting you some answers. There are many options to consider when treating ED. Patients generally begin by trying oral medications like Viagra, Cialis, or Levitra. There are also vacuum erection devices, injections, and urethral suppositories that assist with achieving erections. Penile implants lend more of a long-term solution, rather than a daily treatment or an event-based action. With a penile implant, there are risks and benefits. Some benefits of an implant are that you can have an erection anytime you choose, giving you greater spontaneity. Also, you can maintain an erection as long as you desire, allowing you to give your partner pleasure even after your orgasm. Some surgical risks include infection and scarring. Implants also remove the possibility of obtaining natural erections in the future. Be sure to discuss these and all other risks, including reliability, with your doctor. There are different types of implants. Some are more complex than others, but most work in the same way. 2 cylinders are implanted into the penis that are either rigid or inflatable. In the case of an AMS 3-piece inflatable implant, a pump is implanted in the scrotum. The pump is connected to the cylinders and to a fluid-filled reservoir that is implanted in the abdomen. For this inflatable implant, an erection is achieved by squeezing and releasing the pump bulb several times to inflate to achieve a rigid erection. To deflate, squeeze the deflation button for about 4 seconds and release. After the cylinders are deflated, you may squeeze your penis to make it more flaccid.
What did it feel like? Well, I have no idea. I was asleep. All I know is I woke up in bed with a bandage on me. This is all done through a very small incision at the base of the penis. I went home on a Friday, and I was driving my car again on Monday.
It is an outpatient type of surgery. It's what they call a 23-hour. You go in early one morning, spend a night, come out the next morning. You felt a little bit of pain. It was naturally, when you have surgery, you're going to have some soreness. Was back doing most everything that I normally do within a week.
The recovery was different. It was a 6-week period, and in that time frame, I was told not to lift anything heavy. I took it easy. It wasn't bad. It was relaxing for me.
I could walk into a locker room and you wouldn't even be able to tell. I looked just like everybody else. All of the implant is all in the inside of my body. There's no difference.
A man could walk around naked. He could be in a locker room. He could dance on the table. And nobody's going to know he has this in him. Everything is concealed within the body.
The good thing about the penile implant is it's very personal. No one knows that you have this device unless you tell them. Even in having sex, the woman really doesn't know unless you tell her.
It's real. And with the confidence and with the satisfaction and knowing that, that you can perform and satisfy the other person, there's just nothing like it.
Now I'm totally relaxed. I don't have to worry about it. It's very spontaneous. It takes a few pumps to pump it up, and I'm ready to go.
That's important, to feel like you are a man.
As a woman with a husband who has the penile implant, I get asked this question a lot. How does it feel?
I had no idea what the implant was going to be like, but I can tell you it has been a blessing in my life. The implant itself is so natural, and I keep asking if the feeling is natural for him, and he says yes. And for me, it's very exciting. Once he has an ejaculation, the erection is still there. We can be intimate for as long as I want, which is very satisfying for me.
It's given us back our life. It's given us back our intimacy, and I'm very thankful for it.
If he hadn't told me that he had done this, I wouldn't have known, except that as men age, it's not quite as hard as it used to be. You were taken back to, a much younger time.
We wanted a fix to this problem because it was constantly getting worse.
Right. And the penile implant did that for us. It gave me back my husband. It not only changes your relationship, but it changes you as a person. It changed how we interacted with each other. And now it's natural. I mean, if he starts something, we know we can finish it. And
Or if she starts something, we know I can finish it.
that's right.
We presented to you quite a bit of information, and I know it's a lot to think about. I hope that you found this information helpful and that you're feeling more confident in taking the next step toward treating your ED.